The ultimate heartwarming experience. In 1929, a German surgical resident named Werner Forssmann believed there was a way to access the human heart directly by snaking a tube through a vein in the arm. His superiors told him the idea was suicidal and strictly forbade it. Naturally, Forssmann ignored them. He tricked an OR nurse into giving him access to the surgical tools, tied her to the operating table so she couldn't stop him, and proceeded to stick a urological catheter into his own left arm. He then pushed the 60-centimeter tube all the way up his arm and into his own cardiac chamber. To prove he did it, he walked down to the radiology department, with the tube still dangling out of his beating heart, and took an X-ray. He was promptly fired for his insubordination. But 27 years later, the medical community realized his stunt laid the foundation for cardiac catheterization, and they handed him a Nobel Prize. A great example of how getting fired can sometimes be a solid career move.
The radioactive savior, Marie Curie, is famously known for discovering radium and polonium, a feat that cost her her life due to chronic radiation exposure. But her husband and research partner, Pierre Curie, took the radioactive self-experimentation a step further. Pierre wanted to see what radium did to living human tissue. He strapped a sample of pure radium to his bore arm and left it there for 10 hours. The radiation caused a severe, painful burn that took months to heal, leaving a permanent scar. Pierre carefully documented the destruction of the tissue, which led him and Marie to realize that if radiation can destroy healthy human cells, it can also be targeted to destroy malignant cancer cells. This painful, self-inflicted burn laid the groundwork for modern radiation therapy, which saves millions of cancer patients today. It's a rare instance where hurting yourself actually paid off for the rest of human civilization. The yellow fever cocktail. In the early 1800s, a medical student named Stubbins Firth wanted to prove that yellow fever was not a contagious disease. To demonstrate his theory, he decided to perform a series of self-experiments that can only be described as a masterclass in psychological horror. Firth made incisions on his arms and poured the fresh vomit of yellow fever patients directly into the open wounds. When that didn't make him sick, he rubbed the vomit into his own eyes. When that still didn't work, he built a small sauna, filled it with the vomit, and inhaled the fumes. And finally, to top it all off, he drank a glass of pure, unfiltered patient vomit. Amazingly, Firth never caught yellow fever, and he proudly declared his hypothesis correct. The twist? Yellow fever is highly contagious. It just has to be transmitted directly into the bloodstream by a mosquito. Firth only survived because he happened to use vomit from patients who were in the late stages of the illness and no longer infectious. He endured the most disgusting diet in human history just to be completely wrong. Brilliant.
The bacterial beverage. For most of the 20th century, the medical establishment insisted that stomach ulcers were caused by stress and spicy food. An Australian physician named Barry Marshall had a different theory. He believed ulcers were caused by a spiral-shaped bacterium called Helicobacter pylori. Because no one believed him, and human trials were decades away, Marshall decided to take matters into his own hands. He went into his lab, harvested a colony of the bacteria from the stomach of a dying patient, mixed it into a warm broth, and chugged the entire glass. Within a few days, Marshall developed severe gastritis, vomiting, and foul breath, proving that the bacteria indeed caused acute stomach inflammation. He then cured himself with antibiotics, published his findings, and eventually won the Nobel Prize in 2005. This is the ultimate justification for anyone who leaves dirty dishes in the sink. Sometimes a complete lack of hygiene can rewrite medical history.
The fastest man on Earth.
During the Cold War, the U.S. Air Force needed to know exactly how many G-forces a human pilot could survive during an emergency ejection. Enter John Stapp, a flight surgeon who volunteered to be the primary crash test dummy. Stapp strapped himself onto a rocket-powered sled nicknamed the Sonic Wind No. 1, which accelerated him to 632 miles per hour before slamming on the brakes, bringing him to a dead stop in less than a second. On his final run in 1954, Stapp experienced 46.2 times the force of gravity. The deceleration was so violent that his eyes literally shot forward out of their sockets, his ribs fractured, and his retinas suffered temporary blindness. Stapp survived the ordeal and successfully mapped out the limits of human tolerance, leading to the invention of modern aircraft seatbelts and ejection seats. He proved that humans can survive deceleration forces that should theoretically turn our internal organs into soup. It's comforting to know that our safety features were paid for in the currency of a doctor's eyeballs.
The sleep epidemic. In the 1840s, surgical procedures were a brutal affair. Patients were routinely held down by 4 grown men, while a surgeon amputated limbs as fast as humanly possible to minimize the shock of the pain. A dentist named William Morton wanted to find a way to put patients to sleep using ether gas. Before trying it on a human subject, Morton decided to test the gas on his dog, his cat, and his goldfish. When the animals survived, Morton locked himself in his office, poured ether onto a handkerchief, and inhaled it deeply. He woke up a few hours later with a severe headache, but realized he had been completely unconscious and immune to pain. A few weeks later, he successfully demonstrated public anesthesia at Massachusetts General Hospital. He gave humanity the gift of painless surgery. Though inhaling unknown chemical vapors alone in a locked room sounds less like a scientific breakthrough and more like a cry for help. Subscribe.